Hello, everyone. Today we have with us Dr. Anshuman Kaushal. Dr. Anshuman Kaushal is a distinguished and dedicated healthcare professional with a wealth of experience in advanced surgical technique and patient care. As a fellow of the American College of Surgeons and a fellow of the National Board, Dr. Kaushal carries extensive clinical expertise with a commitment to innovation in the medical field. Throughout his career, Dr. Kaushal has been at the forefront of surgical excellence, continually advancing his skills and knowledge to provide the highest quality care to his patients. His extensive background encompasses both academic practical aspects of surgery, ensuring a comprehensive approach to healthcare solutions. Beyond his clinical achievements, Dr. Kaushal is also a passionate advocate for medical education and continuous professional development. He is dedicated to mentoring the next generation of healthcare professionals, sharing his insights, and fostering a collaborative environment for learning and growth. Hello, Dr. Kaushal. How are you?
Hi, I'm doing well. Thanks for having me today, and thanks for the kind words. Thanks for the introduction.
Sir, it's just that you have the right qualification, right? Like you have the that kind of aura and the presence that we have gone through. That we were so thrilled to have you for this live session. That's why.
The
So,
pleasure
sir,
is
like
mine.
as the
Hmm.
yeah, so so we continue with like what the audience is waiting for, like the
Uh-huh.
insights that they are looking forward to.
Yeah.
So my first question for you, sir, like as a practicing surgeon with deep clinical knowledge and a leader of an AI-driven platform, like how do you see this dual experience informing each other, especially in shaping the future of healthcare?
Okay, this is a very interesting question and a very pertinent one. As a practicing surgeon, I bring lot of hands-on clinical experience, understanding the intricacies of the patient care, surgical procedures, day-to-day challenges being faced by my team, my colleagues. So the whole idea of leading an AI-driven platform, um, basically it allows me to leverage the clinical knowledge to develop AI solutions. These solutions which are practical, which are effective, and which directly address to the real world issues. For example, my surgical expertise it helps in designing AI algorithms which can assist in various aspects of patient care. For example, a patient would need a surgery, so a pre-operative planning. So there are fixed steps on pre-operative planning. Then there are surgeries, intraoperative navigations. Then there are post-operative critical care in the ICU. So with the development of these AI algorithm, what we can do is we can remove the human part where, as of now, people, nurses, doctors, they are spending a lot of time in putting the clinical data, clinical notes on the system. Now, with the advent of these AI-driven platforms and algorithm, the entire data, the entire the medical and the health data can be extracted from the patient directly, which can be analyzed, and all you get is a crux of that. So that is going to help us a lot by making the these algorithms and these symbiotic relation between AI tools. They're not only technologically advanced, but they are also clinically relevant. So this will enhance the overall healthcare delivery system.
Well, sir, like it is very true. Like as you said that AI is being used to like identify the trends like of the patient part. Like you are able to get more insights from the data of the patients, and you are able to provide more patient centric care, like
Right.
kind of the procedure and everything accordingly. That's really great. So like if these kind of things are making possible, that it's more like customized form of treatment
Very
plan.
Very true, very true. Aditya, you are
Yeah.
absolutely bang on, because now we are coming in an era where there is going to be a personalized healthcare system is being developed with the help of all these softwares, AI platforms, and integration of these things into the clinical care. So the time has come where each individual is different, and we have to design the treatments as per the individual's requirement. So definitely we are living in a very exciting times as far as the healthcare delivery is concerned.
There's a lot of things that I'm learning today from your words. Like this is a new aspect that has come in front of a lot of people. I believe the people who will be watching this session afterwards as well, they would be learning a lot of new things. Like, so my next question is that, like, can you elaborate how AI goes beyond just online consultations and integrates more holistic patient experience? Like, if we talk about patient, if we are talking about the patient experience part, then
Yeah.
how do you think?
Absolutely. This is a very good question, Aditya, because most of the time when we talk about technology in healthcare, average people would think that it is, just online consultations. Online consultations are a significant aspect of AI in healthcare, but the potential of AI, it extends far beyond, because by virtue of the ability of these AI engines to analyze vast amount of data to provide personalized treatment plans, and then these things eventually can predict disease outbreaks. They can find a pattern from their data, and then they can predict things. They can offer real time monitoring of a patient, irrespective of your location. If you are suppose now we are living in a time where every week or month we are coming up with new kind of wearable devices which are getting better and better and better. There are patches which you can just apply it on your body, and they will give you your heart rhythm, your temperature, your pulse rate, stuff like that. So all these things are going to help the healthcare personnel obtaining the real time data. Now that person can be in the hospital, that person can be traveling, that person can be at the comfort of his home. That person, even if a person is being transferred in an ambulance from a small city to a big city, there will be a continuous real time monitoring of that patient by a team of experts sitting on these AI driven platforms, where you can even manipulate the ventilator settings and things like that from your mobile or from your laptop. So not only the clinical this thing, but also they can streamline the administrative tasks also by analyzing all these trends. Our healthcare workers will have more time giving care to the patient rather than putting notes. On an average, a nurse would expend somewhere around 15 to 20 minutes out of every 1 hour in putting notes, and doctors are also overwhelmed with these kind of administrative work and all. Now with these things, you will get the complete analyzed data, complete summary of the patient in real time, and you can immediately take the action. You can take second opinions sitting right this thing on your computer. So there will be a completely connected ecosystem. So by integrating all these things into what we call as a EHR or a electronic health record, it can ensure the continuity of the care, making it easier for doctors to track a patient's entire health journey. And they can their decision making will be much better than in past, because now everything is getting analyzed, vast amount of data, and you will get the crux of it, and therefore I can take action immediately rather than analyzing. And then there will be a cohesiveness. There will be I would say the data will be same for everyone, so the team can work more effectively with that, and thereby reducing the human errors. There was a study published by John Hopkins that by using all these telemonitoring and telemedicine services, especially in the ICU, you can reduce the morbidity and the complication rates by whopping 44%. So, this is going to be a groundbreaking thing, and this comprehensive approach is going to create a more seamless and, you asked holistic. So, yes, this is how this is going to, help us in creating a more seamless and holistic patient experience, right from the diagnostics to the patient recovery. So consultation is just a part. It's just a part of the whole journey, and we are technologically the advancements are exponentially. We are improving our things day by day. We are getting more powerful computing algorithms, and groundbreaking researches are coming. So these are going to help us in an integrated effort of individuals, healthcare, and not just a consultation.
Definitely, sir. Like as you said, like AI is not only present on the consultation part; it is present in all the other steps that is going to come afterwards as well. And like just like you said, like I have just one simple example, like where we started by having watches that used to count steps, but now we have watches that even measure our heart rate, calories, and all the other
Mm.
things. Like I read a case study where a smartwatch was able to detect a heart disease in a patient which he was not aware of. Like he saw certain spikes on a regular interval in the record of the script that the detail he used to get from the watch. And he went to the doctor and he found out that he has heart disease which he was not aware of, and it didn't surface in the regular checkups as well. So like he was able to like this would have been, this AI is one of the biggest discoveries that we are facing right now, and like adapting to it is going to change a lot of things in the future as well. Like in not only in terms of the patient part, but also in terms of the doctor's part as well. Like you would be seeing more ways where uh, the time spent on an average patient to cure a disease could be significantly reduced, or to do the diagnosis part could be more and more like improved as well. Like you would be able to identify the effect, like the right disease at the right time, and would be able to deliver the right medication for that part, I believe so.
Absolutely. So, absolutely, Aditya, I agree with whatever you are saying. IoT, or the Internet of Things. These are the devices. These are the wearables which a person would wear, and maybe in future you won't even need to wear them. They will be implanted in you automatically. For example, you must have heard that groundbreaking research by Neuralink, Elon Musk, where they've implanted a chip in the
Mm,
brain, and then a paralyzed patient. So this is the future. We are going to
yeah.
become transhumans. Okay, so we will have all these devices constantly monitoring us, not only calculating your heart and heart rate and things like that, but also biochemical analysis like your urea level, your creatinine level, your glucose level. So there's so many things. Fall prevention, there will be an alert. There are devices, even these watches and these wearable devices. If an elderly person falls, then automatically alert is being transmitted to the healthcare provider, to the families and everybody. So these things are groundbreaking, and then all this data is coming in real time for medical health personnel to analyze them and to take a action. So rather than a reactive healthcare, we are going for proactive healthcare, I would say.
That's great, sir. So, like, moving to our next question, like, as a senior consultant, like, so my question is that, like, as a senior consultant in robotic surgery, how do you see advancement in robotics and other surgical technologies impacting patient outcomes and recovery times? Like, you just told us about how the approach is going to be more proactive, and like how it will be present in all the other steps as well, not only in the consultation part. Like let's go more deeper into this area, like how the advancements in robotics are going to impact that.
Okay, so robotics it's a groundbreaking development which has happened, and with the help of robot, and see, robot is not something which is new. It's been there since like 2002 when Intuitive Surgicals they came up with the robot, and this technology came from NASA. We are sitting on Earth, we are operating rovers on different planets. So from there, this idea came. Now, definitely, a robotic system is just an interface. It surgeon has to be a human. So but now I've been empowered by these robotic interfaces, because my tremors are gone, the human errors are gone. So the patients will have very small holes, and the precision, the degree of precision increases a lot. The bleeding is less, the pain is less. And now with that augmented reality and virtual reality, what is happening is that now you have got a device which you can manipulate, which you can handle, do a very precise kind of surgery, and at the same time there will be an overlay, a superimposition by that augmented reality, where in real time you see the name of the structure, what kind of vessel is this, what tissue is this, and they will also give you accurate a kind of assessment of the tissue, the force which you need to apply. So all these things are eventually it will translate into a much better patient outcome, and these things are happening as we speak. So definitely robotics is something which is the future, and especially in future when we will get those nanotechnology, when the miniaturization of these devices, they are becoming smaller and smaller. So this reminds me a very, when I was a kid, there was a movie, I don't know whether you've heard about it or not, Fantastic Voyage, and then came the Inner Space by Steven Spielberg.
I've seen.
So yeah, in those movies, what the whole concept was, they injected small things, devices into a patient's blood, and then they go in and do the corrective surgery. So I'm very sure that that day is not far away. So with the help of these robotic platforms and AI and augmented reality, the precision of the surgery increases a lot, thereby giving us great results, and a quicker hospital discharge, faster overall recovery. So and it also helps in the predictive analysis. So a surgeon can anticipate potential issues and can plan accordingly. You know.
Definitely, sir. Like, uh, well said, sir. Like, more precision leads to better recovery. Is like more lesser time for the recovery part.
Correct.
Is going to be like the most common. Like, it's going to be a common thing now. Like, the average time spent on the patient would be reduced. The average time spent by the patient for the recovery part would be reduced. They would be able to evolve more further. Like, in terms of like, there are a lot of athletes as well who lose their career, maybe because of the injury part, or maybe because they were not able to recover in the right time frame. Maybe they would be able to get more benefit out of this as well, if they
Absolutely.
are able to get, more free, like, if they are able to recover in a lesser time frame, then they would be able to do their comebacks as well. Like, there are a lot of things. Like, I'm learning a lot of things today in this session, sir. Like, a lot of groundbreaking insights I'm getting. Like, I'm really looking forward to the next question. That is that, like, how do you see the AI bridge the geographical gaps in healthcare access, like, especially underserved communities part?
Okay, so that is where the role of telemedicine, telehealth, and telesurgery comes in. Now, telemedicine, interestingly, it long time back, probably it was 1991, when the first transatlantic surgery was performed. The surgeon was sitting in Manhattan, and the patient was in Strasbourg, France. Okay, now from that, the surgeon sitting in Manhattan could operate on that human patient. This happened in 1990s. Now look how far we have come with these. At that time there was a some time delay was there, but now the time delay has been eliminated. So now we have got there is an Indian company which is coming up with telesurgery. So now with telemedicine, telesurgery in place, the world, it is shrunk. It is completely shrunk. Now what we have to do is, those underserved communities, we have got a good force of nursing community, paramedics, ASHA workers. So why not train them, and they can go to the patient, they can go visit homes, and the skill which is usually concentrated in big towns, big cities, places like Delhi, Gurgaon, Calcutta, Bombay. So they can just go with these devices, the IoT devices, the wearables. They can collect the data. For example, there is a sick child, ASHA worker goes to a place, and then they will have this digital stethoscope. Now I am seeing that patient. Now the digital scope is being put on that child, and the doctor can hear the breath sounds, the heart sounds, 4x. Okay, now this doctor can diagnose and advise the treatment which can be given to the patient. Now the biggest hurdle in telemedicine was the internet, but now we have got a very high speed internet, and with the Elon Musk Starlink coming soon, I guess maybe in a year or so, internet is not going to be a problem. Wherever you go in jungle, you are traveling, you are driving, you will get continuous internet. Now with that, and the skill which is concentrated, and the people which are in underserved area, all you need is developing an infrastructure, developing training of the people. Already there are these paramedic healthcare workers, and we can deliver healthcare. And in fact, this is the way to empower those people who are living in underserved area. So telemedicine, And AI driven diagnostic tools, it can be used in rural clinics to identify disease early. They can identify the pattern in a particular village, and then based on that decision you can utilize your resources for a specific area. You can send those, tele buses. You can send the buses to those villages where they can, examine the patients and do needful, collect the data, collect the samples, and we can make it a regular feature. So by leveraging that, we can ensure that even the most remote communities, they can have access to the specialized healthcare. Thus, you can address all these disparities and improve overall, health of that particular underserved community.
Definitely, sir. Like if this takes place, and if things work out in the right way, which we believe that it will, then like there will not be any like underserved communities available. Like everyone will be equally served, and they will be having the like we'll be able to save more lives as well through this.
Correct. So
Yeah.
those telemedicine clinics can be set up at these places where, a hub and spoke model, I call it. So there should be a hub or a
Hmm.
command center or a control center, and then there will be spokes. So all these, these areas, these cities, everywhere there are teleclinics, and then they can come and they what all kind of super specialists are, they'll be able to consult, any doctor, and that is the only way, because that super specialist is not going to be to that particular town or a remote place. But by using these telemedicine clinics and these hub and spoke models of AI platforms, definitely this is a reality, and this is what my dream is. The entire planet and the healthcare of entire planet. That is the only way where we can solve these burning issues. Yeah,
Definitely, sir. And I believe, sir, it will work out. Even like based on the advancements then that we are seeing right now, I believe that yes, it will take place. Like we would be able to do that as well. So coming to the next question, we have that like what are the biggest challenges? Like we have talked about the opportunities and like we have talked about what kind of future we can have. Like what are some biggest challenges in integrating new AI technologies into existing healthcare system? Like how can we ensure smooth transition for both medical professionals and patients as well?
okay, so Aditya, the primary hurdle is number one, data privacy. Recently, our
Yeah.
prime minister also had a discussion with this Bill Gates regarding that. So, data privacy and security, cyber security, these are few things which you have to be a very robust policies on that. That how do you ensure that data remains private, data belongs to the patient, and it is being used in a proper manner, as well as security standards and all. So our government also, all these digital health tech platforms which are coming up, the government has made it mandatory to connect it with their Abha app. So a complete integration should be there. So by doing so, you can map your population, you can map the instruments, the devices, the resources and all. So for this you need proper policies. So that is again one of the biggest hurdle and challenge. So having proper policies to develop this kind of infrastructures, and interoperability between medical professionals and these tech guys, there has to be a proper coordination. So all these policies needs to be refined. And then another significant challenge is the trust issue. As of now, the trust is not there. But eventually, as these things are getting stronger and stronger and they are evolving, I conducted a survey where I asked that, in the coming future, people will trust AI or doctor. So I got the answer. 60% of the people said that they will trust AI more. But this is something, and there is a reason. There is a reason. The doctor, we give the human touch, but AI will give the proper data analysis, and it will predict. So it is going to empower. So rather than being afraid of AI, these medical professionals should understand that this is going to empower them. So it has to be a marriage between these AI platforms, the tech part, and the doctors. So everybody should, work in unison and empower our patients by this. So we have to create an awareness also for the patients that these things are going to eventually help them. Also, regulatory guidelines, some legal issues. These are again few of the hurdles, which I am very sure that with proper representation from the medical fraternity to the government, we will come up with these policies as early as possible to make this a possibility in near future. And also, COVID has helped us a lot. We kind of we kind of jumped. People, they've accepted all these I would say these platforms because of the COVID. And now with that epidemic or pandemic behind us, the government are also taking these things, telemedicine and role of technology, very seriously, and doctors as well, and patients also. So now, if you can, you have this power to consult in the comfort of your home. You can consult your doctor, and this I think this is going to be the future, especially with these VR technology coming in. These Apple glasses and these VR techs. So it will give you, a doctor would have a VR glass, a patient would have a VR glass, and then they can have a consult in a common, a virtual environment. Your patient is in ICU, you are sitting in like America, which happened in COVID. People were not able to see their parents. So now with these devices, they can meet in a virtual space. So just imagine, there is something known as VR therapy. VR counseling, meditation can be offered. Various schizophrenia, depression conditions like these can be treated using VR therapy. So all these things, I'm very sure that everybody would understand the implications of this revolutionary technology, and these hurdles, they can very well be taken care of with if we approach it at the right frame of mind, with the proper participation of all the stakeholders, including government, administrative officers, IT tech persons, people at large, communities, doctors, nurses, everybody.
Well said, sir. If the stakeholders participate in the right way, then in terms of the more the awareness is created, the more these hurdles can be easily removed easily. Right? Uh, you said many new unique points like VR therapy, like something that I'll be looking forward to if I'll ever go for a treatment part. Like yeah, like during the COVID, where a lot of
Yeah.
patients were
Mental health
getting
is one of
were
the,
not.
yeah,
Yes,
absolutely.
sir.
Mental health is one of the key areas where it can be offered in the privacy of your home. Confidentiality can be maintained, and it's going to work a
Yes.
lot, help you a lot.
Yes, sir. Yes. During the COVID period, when you mentioned, like, I have heard a lot of patients who were not able to recover in that pace because they were missing their dear ones on a regular basis, and they were not able to meet because of the disease that they were suffering from, and that
Right.
was also impacting their recovery. So,
Yes.
if this can happen, then it will help them. These kind of patients like will have a very big impact in these kind of patients part. Like they would be able to feel at ease, like they would be able to feel more comfortable as well. They will know that yes, the people that they care for are with them only. That yes, sir,
Absolutely.
I'm like
And this is a
VR is
very
going
important
to.
part. This is a very important part. Physical health is important, but end of the day, it's in your mind. So mental health is also as important as this thing. Because many of the times, these elderly people who lost their life because of the depression, because of that sense of helplessness. Now, if we take care of that body, these things can affect your immune system also, these this depression and things like that. So we have to focus on that part also, and the technology can definitely help us in that.
So, sir, looking ahead, what exciting developments do you foresee in the, like, you have talked about a lot of advancement that can happen in the future, but like to like the how AI can transform healthcare on a global level, like global scale, if we are talking about, like.
Okay, so again, now the future is incredibly promising. Why? Because there is something known as predictive analysis. Now we have predictive analysis, which was not there, because previously all these research or the data which we were collecting, humans were analyzing that, and humans have a capacity; they cannot go beyond. But now, I mean, you know, billions and billions of terabytes of data can be analyzed just like that. So with that predictive analytics, you can, I would call it as a 3P model of AI: predictive analysis, preventive, and prescriptive. Preventive part, because now we have a data which is coming to us. Now we understand what can go wrong in a particular family. We can do genetic analysis, we can study DNA in great detail with these AI softwares and algorithms. Now, we were talking about the personalized healthcare. So what is personalized healthcare? We will have a complete genomic map of you, and then we can predict that at this age you are going to have this particular disease. Not only cancers, but also diabetes, blood pressure, Alzheimer's, things like that. So it's people right now, they kind of they are scared, but I don't think there is any need to be scared about. It will empower you. It will empower you, and then you can accordingly, you can take precautions. For example, if you carry the gene of a particular cancer, then you should avoid smoking. If you have that gene of developing heart attack at the age of 60, it can be predicted by analyzing these genomic sampling and data. So you can take precautions. Also, genetic engineering, genetic modifications, these things are also coming. So this is going to be the future. Nanotechnology, this is going to be the future. So like we discussed, reactive to proactive, you will be having implants in your body, the bionic implants and the wearables, and they will, continuous emission of healthcare data will be there, which will be captured by a software, which will give you prompts that, for example, you will get a prompt that you had a irregular heart rate at 7:24 a.m. So kindly do something. So previously you could have thought, oh, थोड़ा सा चेस्ट में प्रॉब्लम हो रहा है, एसिडिटी की दवाई खा लेता हूँ. कितना होता है ये प्रॉब्लम? हार्ट अटैक का सिम्टम्स और गैस्ट्राइटिस के सिम्टम्स एक जैसे होते हैं. बट नाउ यू आर बीइंग अलर्टेड, that your heart rate was not okay, so immediately go and seek help. So these kind of predictive models are coming. So you will be surrounded by these softwares, and these data will be analyzed, and you will be getting prompts, and this is going to be completely transforming, completely transforming. And so it is like a 24/7 support and guidance, 24/7. So on a global scale, vast amount of data analysis will be there. So we will know which community, which particular subgroup, which area has got what problems. So then accordingly you can take care and modify things accordingly. So this is going to be this is how the future of health, which I according to me, this is going to be the future of the health, that you will be governed by softwares, intelligent softwares, and these bionic implants, the Internet of Things, and AI platform. With, of course, the doctors are not redundant, so we have to be there in the at the helm of the affairs.
Yes, sir. Like one of the key points that you mentioned right now, like uh, based on that, like I also believe that like if we are able to analyze the data of the patients on a regular basis, like they then and on a large scale as well, if we are getting the data, then like the medicines, like even medicines can be present. Like for an example, in North
Absolutely.
Zone, if people are having a certain kind of issue which was discovered through the data part, then the inventory for that particular type of medicine can be maintained properly, so that everyone can have the access for that. Like there is no shortage for that part as well. Like we can or like for the south region, if they are like, well, most frequently south people have more stomachache issues, whereas not people have more BP issues. So BP medicine should be more frequently accessible to the North Indian people, whereas for the South people, most stomach-related issues, medicine should be frequently available, so that they can have the right medicine. Like, and that can be done because of the data part only. Like as you said, like if we will be getting the data of all the patients on a regular basis, then the insights that we are going to draw in the future is going to scale a lot of things on a geographical level
Oh,
as well.
absolutely, absolutely. There is something known as precision oncology, which is in vogue now. Now, in precision oncology, as of now, for example, you suffer from a particular disease, and there is another person coming, say, suffering from typhoid. Then both the persons will be given the same medicine. But now, or for example, somebody has a blood cancer particular type, then there will be a chemotherapy. But now with this analysis of this data, now we can design specific medicine, that you might get benefit from this medicine, but the person who is also suffering from the same problem, but that person would be benefited more from that different medicine. So this is what we call as a personalized care. Similarly, in oncosurgery, cancer surgery, this particular medicine or a radiation, what kind of chemotherapy, what kind of surgery is going to help this person based on that genetic analysis. So this is going to change it completely. So it will be like personalized healthcare. You are being governed 24/7, being watched by these things.
Like, uh, I learned a lot of things today, sir. Like, I am not from the medical background, but these are the things that everyone should be aware of, I believe. Like, the kind of advancements and the things that not only for the doctor's part but for the patient's part as well, like for the normal people as well, because if they are aware of these kind of services, then they can reach out to the professionals as well and ask for these kind of services if they are not able to find it, or they can look for these kind of things if, because many of the times, one way or the other, we are looking for a better treatment for ourselves only.
Correct.
Like, as much as the doctors want to provide the best treatment to the patient, the patients also are looking for the best treatment for them, so that they
Correct.
can recover from their disease. So if these kind of things are more like explained to the people, if they understand these kind of things, then I believe that they would be able to get better and would be able to improve in a better way. Like, they would be, like as you said, that we are entering the stage of nanotechnology, and we are entering to the stage of how we are going to see the different advancements. Like, people are would be able to meet each other on VRs as well in the future. People will be able to Doctors will be able to meet in a virtual space with a patient and would be able to do the diagnosis over there as well. So the or provide a treatment. So these kind of things, if they take place, then yeah, the discussion that we are having right now is going to be more deeper part, like how we are going to improve these things part. Right now we are working only regarding like how we need to adapt it, but at that time we will be doing a more detailed discussion where how we can improve this more further, so that we can provide better care and more better care for the coming generations as well. So
Absolutely.
thank you so much. Thank you so much for joining. I really learned a lot of things, and I believe the people who are going to watch this or who are attending this have learned a lot of things as well today. Thank you so much, sir.
Thank
It
you.
was a
Thank
pleasure.
Same here. Thanks, Aditya. And I thank Gravitas AI team also for having me today.
Sure, sir. Thank you so much.
Bye. Take care.